Hello, my name is Kaylin Bridges, and my research project is on the opioid epidemic. So there's an opioid epidemic in the entire United States of America right now. However, my project is strictly on the opioid epidemic in South Carolina. Down in the far right-hand corner, there's a chart that shows that prescription opioids is the highest related overdose deaths in South Carolina. Therefore, that means our healthcare providers are prescribing these opioids that are killing so many people. Some personal experiences. I actually have a family member that has fallen victim to opioid abuse, which makes this very interesting to me, and I'm very curious. And also, the drastic increase of deaths due to this is really has really caught my eye. So my research question is, what does the literature say about the problems American society is facing due to the opioid epidemic? Okay, so for the first article I did, they used opioid abuse prevention study to guide their study. This was where the South Carolina House of Representatives came in and made some recommendations and passed some bills for the healthcare providers so they can get this opioid epidemic a little bit more under control. In the second article, they used a three-part primary prevention tool guide to identify a potential opioid abuser. So this is how you catch a patient before they become an opioid abuser. So in the third one, it was an interview of the director of the South Carolina Department of Alcohol and Drug Abuse Services, and this was to discover how that methadone treatment is being funded. In another article, this was where they ensured opioid abuse patients are receiving adequate holistic care, making sure our nurses are giving the same care to these opioid abusers as they would to a cancer patient, making sure everybody is treated the same. Another article was to decrease the chance of opioid abuse. Nurses will screen, assess, and educate patients on the opioid epidemic. And then on the last article I read, they used a screening tool to determine if the patient has opioid abuse disorder prior to prescribing them opioids. So you want to make sure before you go and write somebody some morphine prescriptions that they don't already have underlying opioid abuse problems. You don't want to feed that disease. So I had 5 qualitative articles and 1 quantitative article. In the first one, like I said before, the opioid abuse prevention study, this was where the House of Representatives came in and limited opioid prescriptions to only 5 days. There was also a bill that stated that there needs to be a count of how many opioids are going out into the public daily, how many you're prescribing to your patients. Also, they want practitioners to review the patient's history if they have any controlled substances disorders before they write another prescription for a opioid. A primary prevention tool was this 3-step process to help identify a potential abuser. The opioid risk tool was just a tool to identify at-risk patients. The National Institute of Drug Abuse Quick Screen is used to screen to see if a patient has substance abuse when it is suspected. Also, in the articles it said to screen, assess, and educate patients on opioid abuse. This is giving patients the right information they need before they fall victim to this awful epidemic. And the methadone is a drug used to help people that are on opioids to come off of it. It makes it a little easier, and it weans them off without going cold turkey. So another method is evidence-based ethical recommendation. This is just giving you some recommendations on when you're having a hard time as a nurse finding the right way to care for an opioid abuser, making sure that their pain management is the right thing for them. In the table it shows some ethical principles to go by and how to apply that in the clinical setting. You also need to consider NSAIDs as the first-line medication in opioid abusers. You don't want to go straight to the oxycodone or morphine or Dilaudid. Also, there's a screening, brief intervention, and referral to treatment tool. So it says, like, if a patient has come in and wants opioids when they're not truly needed, or they need to manage chronic pain, then there is a way for you to refer these patients to another facility. And there's another method was a screening tool in the electronic medical record. This goes to like the providers before they write a prescription. This is going to alert them that the patient has past opioid abuse problems or even present opioid abuse problems, and it's going to stop them before they prescribe them another opioid. So some results that I have for qualitative, they were able to identify a patient at risk for developing an opioid use problem. They were able to modify treatment plans based off of these assessment and screening tools that indicate opioid use disorders, and the nurses are able to provide holistic care to these patients. On my qualitative study, these screenings identify 4.2% of the 1,032 people were actually opioid dependent, therefore they were able to make some modifications to their treatment plans. Some limitations I found was the lack of participation of healthcare providers. Since these recommendations weren't mandatory, there was a lack of participation. Also, there was only 4 months of the primary prevention approach was not documented, so that lacked in a lot of data. The ethical pain management strategies aren't readily available to these nurses, so there are recommendations out there, but they're not ready for the nurses to use in the clinical setting. And also, there's no validated screening tools available for nurses in the emergency department. And with the opioid abuse disorders coming mainly from opioids being prescribed to them by physicians in the emergency department, I think these screening tools really need to be in the emergency departments to put a slow on this epidemic. Some recommendations I got from these articles from the author was more agencies need to partner with the STR to help fund for the methadone clinics. Another was provide mandatory nurse educational sessions on interventions when caring for an opioid-dependent patient. Refer patients to another facility when they seek pain medications when not needed or need chronic pain management. I mentioned that in a previous slide. And formal research that ensures the emergency department is not the gateway to opioid misuse. So providing those screening tools in the emergency department will help this. And then some personal recommendations I have is extend the length of the studies to have better results and conduct studies to measure the benefits from the screening tools that are recommended, so we can see if these things actually work. So some things I gathered from this research project was how, as a nurse, I can make a difference in this epidemic. I actually know more about the pandemic now. Sorry, epidemic, not pandemic. So I can better understand this issue. I can also educate my patients on the severity of this disorder so they don't fall victim to it. And to let my patients know if they want help, then there is help available if they want to end their addiction. And I will care for each and every patient the same, no matter their earthly struggles.